on and off, and this is if you wanted to sort of lock it. This first section, what that'll tell you is perhaps if something is with the bed going on. So if you look here, can you see that that light is illuminated? Well, that's letting you know the side is down. So you're not going to be able to start rotating the patient if the side is down. It will beep at you and not let you, just because it's saying, hey, you can't tilt someone there and they might fall out. So there's some functions that it won't let you do. So that's that. So if you were to, sorry, Ansu, because you're close to that end, do you mind if you lift the cot sides up now? You'll just see, once they've come up, that those lights will now go off, and then you're all right to sort of do things. This other one, if you were to sit the patient up and they were greater than 30 degrees, that would illuminate again, and it would again just let you know that that's what setting you're in. This, the lady said to me, as if it needs a service or if there's a problem with it, something's gone wrong. And then if you do hear an alarm or anything, if you just press that, that would just mute it. So this next section, this is kind of quite funky as well. But if you can see, so there's a person on the bed, and can you see there's a little scoop there? So what this does is this lets the air out of the mattress at that point. So if you've got a patient and you want to get them out of bed, they're getting into a commode, you just want to get physio, you want to see how they are. So if you were to drop that aside and then sit, you can do this if you want, and so if you just drop that aside, if you sit on there like you're a patient, so you can feel it's just as normal, sort of stay quite firm. If we press this now and hold, you'll see the light comes on and it's flashing, just letting us know that that is letting the air out. So, and when you hear that beep, that's letting you know we've done it now. So if Ansu was then going to try and get up, you'd encourage your patients, wouldn't you, to put your hands down? So if you notice now, you're probably feeling the bed at the bottom as opposed to like the spongy mattress at the top. Do you know what I mean? Like if you were feeling it a bit more. See, because when I'm with a patient, I normally always static the other one, because I think if someone's trying to move, you're like up or down and a bit. So when that does lower, that's kind of what that's for. If you go down to the second one, can you see the scoop is underneath the head? So that, if you were to press that, it will change the mode. Again, it will flash while it's doing it, but that's going to take the air out of where your head is in the middle. Right, so I was thinking, when would we use something like this? So perhaps what if you were washing a patient's hair and you had the basin underneath their head and it just helped you like get underneath their head more? Then I thought, what about when you're proning a patient or something? Like that could be good to give you that extra room, because you know you're trying to get underneath and you can't be like lifting people's head back and you've got that kind of like tube sort of thing. So again, that's what that'll do. Then this third one, this is like, it's showing you all the arrows are up and it's kind of flat. So I'd say that you're just returning it into some sort of static mode. And if you start seeing here, it's kind of illuminating that it's firming up the mattress. So obviously we dropped the side, then we stopped it, we dropped the head, then we stopped it. Well, now it's just kind of just making it all sort of firm across the full mattress. Now this one, imagine you're taking your patient to CT. What do we normally do? Or even if they're going across even to theatres or something, we unplug the air mattress and we plug it into one another, don't we? And then you take the pump off the bed and then they go. Well, you can't do that with this, because this pump goes with the bed. So this picture here is showing, if you press that now, it's letting you know that you're transporting somewhere. So if you're going down now, this has kind of got this battery inside it as well. So you need to unplug it, of course, because you need to put that patient where you're going. It won't deflate. So it won't deflate. So you're then in that mode. So that's a good one to have as well. So it's not going to start changing things and like make the patient just like shrivel up inside the mattress or anything. So this next section here, you know, like our other ones, you tend to, you know roughly what your patient's weight is, and it gives you a range. You've got like this small, medium, large, or heavy, light, medium. Well, this one it tells you. So this can take a patient up to 227 kilos, so anything between 45 kilos and 227. Right? Difference. This is the ranges that would take. But what it also wants you to do is, where are you on that range? So if you look, if you're 45, you're at the lighter end. If you're at 75, you're at the heavier end. To adjust this, you go up and down. So if you've got a patient that's 50 kilos, we want to go just, sorry, it don't like me because of side. You know when you just heard that beep? So if ever you hear something and you think, hang on, this isn't right. Oh, and I think as well, it's because it's in static mode. So I've taken it out there. So we want to change this. Can you see? You have to go through all of them. So we just keep pressing it. So there's my 50 kilo patient. Now this bit is telling you, okay, well, we've got a patient that's pretty light, so we don't need to make this mattress really firm because we don't need a lot of effort to air this patient. So if you look here, the cells are kind of inflated quite low down. But as you start getting heavier, so they're like 70 kilos, so you want to have them on that end of it, and you'll see that these will start to change. And then if we go through to someone that you might have that's like 190 kilos or something, let's have them on there. Can you see now it's having to fill the mattress up more into the top? Because if you imagine, if you've got a heavy patient on your mattress and it's not inflated very much, it's going to be on like a lilo, isn't it, that hasn't got a lot of air in, you're just going to sink in. But the more you puff that lilo up, the more on the top of the mattress you will be. So that's kind of good. But what you can also do is, if someone likes a firmer mattress, you can actually manually just keep pressing this and changing it. So if someone thought, I don't like this mattress, it's too soft, you can go up like this. And don't ever worry that you think, do you know what, I can't remember what the original settings were because I've really fluffed this up now, you know, this isn't good. It's not. It will go back to default. So if you think, oh, you know, you can turn it off or on again if you want, or if not, let's just go onto a different setting and you'll see straight away. So if you think, oh, I want to change it, there's still 200 kilos, but